Thank you, Madam Speaker. I rise to raise question 41 of 2015, registered under my name, and asking the Minister for Health and Medical Services. Can the Minister briefly explain how postgraduate medical officers in-service training in Fiji are progressing in the various areas of specialization during the first quarter of 2015? Thank you, Madam Speaker.
Thank you. I give the floor to the Minister for Health and Medical Services.
Thank you, Madam Speaker. I'd like to thank the Honourable Wande for his question. The training of the people in the Ministry of Health is one of the most important roles that we have. There is a great need for specialization to ensure that our clinical people have the skills that allow them to deal with the people that we have in this country. One of the problems that we always have in the Ministry of Health is the number, the range of the people that we need trained and the amount of money that is available. One of the issues that we've had in the recent past is the money that has been made available for training and education has had to be used also to cover for bills of previous years. But nevertheless, there is a focus in this year to try to come up with the training of our doctors and nurses in the various clinical areas. One of the things that we do emphasize greatly is the need to train our officers who are already in the sector. There's a need to be able to provide them the training. At the moment, already in the program for continuing education in the postgraduate programs, for doctors and for oral health, for public health, we have a total of 60 people that we are planning to put through the program. And the new intake is talking about a figure of 80 people, including doctors in clinical areas, oral health, public health, and even nurses in the various specialties. But with the constraints of funding, the exercise that we are now in is prioritizing these different areas. As there's always a difficulty in getting the adequate number of funds that we need. So the total required for postgraduate, for both continuing and new intake, is about 140 officers. Of that amount, we're not in a position to provide the full training at the moment. So we will need to be able to specialize this, and our priority areas for postgraduate training will include areas like maternal health, child health, anesthesia, public health, pathology, emergency medicine, surgery, mental health, midwifery. This is for nurses. And in addition to the postgraduate training programs, we also look to be able to send our people offshore whenever training opportunities come up. We've received recent offers from places like Israel, and hopefully after my recent trip to India, there'll be other offers for providing training. So there's an urgent need for us to be able to do this, and we will look to be able to provide it to the best of our ability with the resources that we have. Thank you, Madam Chair.
Thank you, Honourable Minister for Health. Honourable Karwaki.
Thank you, Madam Speaker. Supplementary question. I thank the Minister for Health for highlighting that the problem with his ministry is money. This issue, Madam Speaker, was highlighted in the dailies 2 weeks ago by one of the consultants in the CWM hospitals, who said that training has been carried out by the Ministry of Health. The problem is there are no posts, the position for them to occupy, because after training they had become specialized in those areas they have been trained in. And they no longer see it attractive to remain in the hospital services. So they are moving elsewhere. If the Minister could probably explain that, whether that is so, because that was highlighted by one of the consultants. And also, Madam Speaker, I've been reliably informed also that most of these consultants who had been trained and are qualified to occupy consultancy positions are now wanting to move to the FNU medical school to take a position over there. And also, if for a measure to attract them to stay and remain, probably the Minister could explain the state of the accommodation at Extension Street. This Honourable Speaker, if we talk about those people living in the squatters, our medical officers are actually living in the squatters at Extension Street. And they are there to be on call 24 hours, and also they go to work 8 hours a day. Maybe the Honourable Minister can highlight this Honourable House on that. When those consultants coming from overseas, they are given accommodations that are suitable for doctors to live in. But those in Extension Street, Madam Speaker, those are just fit for squatters to live in. Thank you, Madam Speaker.
Thank you. Honourable Minister for Health and Medical Services.
I could not understand the Extension Street. I suppose that is a residence for doctors. But what I will say, that we do realize I have the opportunity to review the applications of people who are applying for the different positions within the ministry. And we are finding that in a lot of cases, the higher level jobs, higher level positions which require some minimum qualifications requirements, a lot of these positions we are not able to fill because people don't have the qualifications. So that is an exercise that has to be ongoing. In terms of the accommodation that doctors reside in, whether they're living in conditions that are, as has been mentioned here, not fit for people to live in, that is something that I need to go back and check out because I do not have the exact details of that. Thank you, Madam Speaker.
Thank you. Honourable Noikulu.
Speaker, I'm surprised to hear the Honourable Minister saying that there are financial constraints. True, training is important, but you should be able to budget and plan well ahead. So the question that I would like to put is that what are these constraints? And you hear also, some who are entitled to scholarships are now being said to go to TELS. What are these financial constraints, and why were these not addressed in last year's budget?
Thank you, Honourable Minister.
Thank you, Madam Speaker. I think we're all very familiar with the budget process. When we come to make a budget process, we always have a long list of things that we want. At the end of the day, it is always a balancing act between different priorities. That is the normal budget process. So like any other ministry, the Ministry of Health came with a long request of things. At the end of the day, there have to be give and take between what is required in one sector vis-a-vis another sector. That is the name. That is how budgets are done. Budgets are not done in utopia where everything you want is requested. So we realize those difficulties, and that is something that we've been able to do. And we will continue to try to work towards our vision of much as possible using available resources that we have to try to provide the best possible quality of health and medical services we can provide.
Thank you. And I'll ask the Honourable Sir Ronro to have the floor for your last supplementary question.
Madam Speaker, I hear the Minister on the number of post-medical graduate. They are doing a prioritizing exercise. Can the Minister inform this House how are they managing the prioritizing exercise, and who is funding the cost of this postgraduate in-service training?
Thank you, Honourable Minister.
Thank you, Madam Speaker, for that question. The funding for the postgraduate training within the Ministry of Health has traditionally been funded by the Ministry itself. That has been the way that it's been carried out. With the limitations that we have now, we are looking at ways in which we can use the resources that we have to have the best number of people we can get trained in the priority areas that we have. We had sought to look at the TELS program, but TELS is only for undergraduates. So currently, if we're looking to provide priority training for people in the specialization, it will need to come from within the ministry.
Thank you very much. I will now give the